Assalamu alaikum. My name is Syed Bazan Muzaffar. My roll number is BP1650218. The topic I am going to represent is Indinavir, while the main topic is rational and irrational use of drugs. Let's start the topic. Indinavir is an antiretroviral drug that comes under the class of protease inhibitors. It is a white soluble powder administered orally and with other antiretroviral drugs. The drug prevents protease from functioning normally. Subsequently, HIV viruses cannot reproduce, causing a decrease in the viral load. The indication or uses of Indinavir are as follows. The Indinavir is used to treat immunodeficiency virus along with other medications. Indinavir is a class of medication called protease inhibitor. It works by decreasing the amount of HIV in the blood. The rational use of Indinavir is that it is a class of medication called protease inhibitors. It works by decreasing the amount of HIV in the blood. Irrational use. If we talk about the irrational use, Indinavir do not actually cure HIV. It may decrease your chance to developing AIDS, that is acquired immunodeficiency syndrome, and HIV-related illnesses such as serious infection or cancer. While if we talk about the drug interaction, eclamprutinib, the metabolism of Indinavir can be decreased when combined with eclamprutinib. While if we talk about the acarbose, the therapeutic efficiency or efficacy of acarbose is decreased if it is used in combination with Indinavir. The dosage form available of Indinavir are only capsules. Just for this reason, Indinavir is not available for neonatal use. It may be used for peds, but if we use this in peds, we will start from a lower dose as compared when we use it in adults. The brand name for Indinavir is Craxivan. Merck is the founder of this. Indinavir is the research product of Merck. But since 2005, Indinavir is not in practice due to its side effect and toxicity. Therefore, I'm not here mentioning the price of Indinavir. If we talk about the alternate drugs, Nelfinavir, Sequinavir, or Eptibus are the alternate drugs for Indinavir. Nelfinavir is only used when Indinavir causes patient compliance problem. And then if we talk about the pharmacoeconomics point of view, there is not much to talk about it because the drug is banned since 2005. So just for an overview, I copied from an article and here's the exact word of the article. I'm also in the reference column. I have shared the link of the research article. Indinavir cost about $12 for a daily dose, which is 24% less than Invirase and 33% less than Norvase. These both drugs, Invirase and Norvase, are not available in Pakistan because the company use a single distributory system to sell these drugs. The retail price was marked up 77% by the pharmacy that sold it. So the lump sum point of view over here is it's pretty much expensive for a normal person. If we talk about the toxicity and adverse effect, the main adverse effect and toxicity seen with Indinavir are nephrolithiasis, that is the renal stone or kidney stone, that may lead to severe condition, that is kidney failure, or we can also say that in medical term, renal failure. Unconjugated hyperbilirubinemia without jaundice, abdominal pain, nausea, dry skin, and lips. Gastrointestinal disturbance is also there. That includes abdominal pain, diarrhea, nausea, vomiting. Along with that, general malaise and fatigue is also there. If we talk about the contraindication of this drug, that is Indinavir, Indinavir is contraindicated with drug that are used in diabetes, high cholesterol, high amount of triglyceride in the blood, that is particularly mean BP, hemophilia, and liver problems. If we talk about case study, here I am going to represent you the case. A 40-year-old man was found to be HIV positive with a low CD4 lymphocyte count, that is 54 microliter, and a high viral load, that is 527,774 copies per milliliter. Site therapy was started, that is Indinavir, lamivudine, and stavudine in July 1997. In November 1999, means after 2 years from the initial of therapy, the patient asked to put on a twice a day therapy. He then started a combination of two protease inhibitor, Indinavir and ritonavir, in association with the same two nucleoside analogs. However, by mistake, he at one day he took double doses of Indinavir. That means 1600 milligram dose a day and ritonavir 200 milligram twice a day. His CD4 lymphocyte count peak up to 480 per microliter and the viral load was below 50 copies per milliliter. After 3 days, he developed severe episodes of renal colic, hematuria, and acute pain in the right wrist. A blood test showed that the person has normal urea, creatinine, transaminase, and uric acid. How to adjust this situation? If we want to solve the case or any particular case of any patient, we will proceed in SOAP notes form. So first subject, the patient suffer from HIV positive, low CD4 hematocyte count 54 per microliter and a high viral load, that is 527774. Along with that, we will also include the patient's age, that is 40 years. He developed several episodes of renal colic, hematuria, and acute pain in the right wrist. The medication that are used in the for the patient is therapy was started. After 2 years, the patient asked to put on a twice a day therapy. Object: the CD4 lymphocyte count was 480 per microliter and the viral load was below 50 copies per milliliter. A blood test report showed a normal urea, creatinine, transaminase, and uric acid. While the assessment for the patient is that the symptoms subsides after the interruption of the antiretroviral drug for 5 days. So if we talk about the plan, when we restart the antiretroviral drugs, the drug block a protein that infects cells need to put that infected cell needs to put together new HIV virus particle. Once the patient gets better, his previous treatment will be started again and the side effect will not recur as well. So here's the solution of the case. Thank you.